Azoospermia. The word itself might sound complicated, but it simply refers to the absence of sperm in a man's ejaculate. It's a significant cause of male infertility, affecting millions worldwide. In this video, we'll delve into the causes, diagnosis, and treatment options for this condition, providing you with a comprehensive understanding of azoospermia. So, what causes azoospermia? The underlying reasons are varied. One broad category is obstruction, where there's a blockage in the tubes that transport sperm from the testes to the penis. This could be due to infections, injuries, or even congenital abnormalities. Another major cause is problems with sperm production within the testes themselves. This can stem from hormonal imbalances, genetic factors like Klinefelter syndrome, exposure to certain toxins like chemotherapy drugs, or even conditions like varicocele, which is an enlargement of veins in the scrotum. Lifestyle factors like excessive alcohol consumption, smoking, and anabolic steroid use can also play a role. To understand azoospermia, we need to look at the process of sperm production. The testes, under the influence of hormones like follicle-stimulating hormone or FSH and luteinizing hormone or LH, are responsible for creating sperm. These sperm then mature as they travel through the epididymis, a coiled tube behind the testes. They then travel through the vas deferens, where they mix with fluid from the seminal vesicles and prostate gland to form semen. In obstructive azoospermia, this pathway is blocked, preventing sperm from reaching the ejaculate. In non-obstructive azoospermia, the testes are either not producing enough sperm or aren't producing any at all, often due to damage or hormonal irregularities. Azoospermia affects approximately 1% of all men and contributes to around 10–15% of male infertility cases. While precise global statistics are challenging to obtain due to varying diagnostic practices and access to healthcare, studies suggest that its prevalence can differ based on geographic location and underlying risk factors. For example, areas with higher rates of sexually transmitted infections may see more cases of obstructive azoospermia due to scarring of the reproductive tract. Often men with azoospermia don't experience any noticeable symptoms, which is why it's frequently discovered during infertility evaluations. However, depending on the underlying cause, some men might notice changes in their sexual function, such as decreased libido or difficulty maintaining an erection. In cases of hormonal imbalances, they might experience symptoms like fatigue, decreased muscle mass, or changes in hair growth. In rare cases, pain or swelling in the scrotum can be present, particularly if a blockage or varicocele is the cause. Diagnosis usually begins with a semen analysis. If no sperm are found in the ejaculate after multiple analyses, further investigations are warranted. These may include blood tests to measure hormone levels, particularly FSH, LH, and testosterone. A physical examination is performed to check for any abnormalities, such as varicocele. In some cases, a testicular biopsy may be necessary to determine if sperm production is occurring within the testis. Genetic testing may also be recommended to identify any underlying genetic conditions. Azoospermia is generally classified into two main types: obstructive and non-obstructive. Obstructive azoospermia means the sperm are being produced, but they cannot exit the body due to a blockage. Non-obstructive azoospermia means the testes are not producing sperm properly. Within these categories, there can be further sub-classifications based on the specific cause, such as pre-testicular related to hormonal issues, testicular related to problems within the testis, and post-testicular related to blockages. Treatment for azoospermia depends heavily on the underlying cause. For obstructive azoospermia, surgical procedures can sometimes correct the blockage, allowing sperm to flow freely. These procedures might involve microsurgical reconstruction of the vas deferens or removal of epididymal cysts. For non-obstructive azoospermia, treatment focuses on addressing the underlying hormonal imbalances or other factors affecting sperm production. This may involve hormone therapy, lifestyle changes, or, in some cases, assisted reproductive technologies like sperm retrieval followed by in vitro fertilization or IVF. Sperm retrieval can involve extracting sperm directly from the testes or epididymis. If sperm cannot be retrieved, donor sperm is another option. While not all cases of azoospermia are preventable, certain lifestyle modifications can reduce the risk. Avoiding excessive alcohol consumption and smoking, maintaining a healthy weight, and protecting against sexually transmitted infections are crucial. Limiting exposure to toxins and avoiding anabolic steroid use are also important preventive measures. For men undergoing cancer treatment, sperm banking before starting chemotherapy or radiation can preserve their fertility. The prognosis for men with azoospermia varies greatly depending on the cause and the success of treatment. Obstructive azoospermia often has a better prognosis than non-obstructive, as surgical correction can restore fertility in many cases. In cases of non-obstructive azoospermia, The success of treatment in IVF depends on the severity of sperm production problems and the availability of viable sperm for retrieval. Ongoing research is focused on developing new treatments to improve sperm production and enhance the success rates of assisted reproductive technologies. Gene editing and stem cell therapies are emerging areas of exploration that hold promise for the future treatment of severe male infertility.